Spending a lot.
All right, Britta, thanks so much. Right now, Houston Mayor Sylvester Turner and Harris County Judge Lina Hidalgo are holding a news conference.
They're announcing some new resources for essential workers during the coronavirus pandemic. Let's listen in right now.
And then I want to also acknowledge Melanie Johnson, who's with Collaborative for Children, President and CEO. Thank you for your work. Richard Shaw, who's here, the committee chair and labor representative for the Gulf Coast Workforce Board and Workforce Solutions of Harris County. And then there are a number of other parties who are here. I do want to acknowledge Marissa Aho, who's with the City of Houston, the Chief Resilience Officer. I want to thank those who keep the city running, and I know the judge will be thanking those who keep the county running. They include our first responders, healthcare and public health employees, Metro bus drivers. They are essential government workers. Also, grocery store employees and delivery workers, construction workers, all those who work in critical infrastructure as identified by the U.S. Department of Homeland Security, National Cybersecurity and Infrastructure Security Agency. I recognize the challenges that you and your family face in these most difficult times. There is no playbook for a pandemic. Essential workers have kept our city and county operating since the beginning of this health care crisis. On any given day, finding quality child care is critically important for parents who work outside the home, and today this issue is further complicated by the fact that many of our most reliable systems of child care, from local public schools to child care centers, are challenged by COVID-19 closures and a great deal of uncertainty. We recognize the need for our valiant workers and public servants who must report to work to maintain Houston's and Harris County's essential services to easily find quality child care. To better understand the needs of our public servants at the City of Houston, I issued a citywide survey to identify the child care needs of employees with dependents 12 years of age or younger. I was overwhelmed by the rapid responses calling for a system to connect parents with child care options for infants, toddlers, children, and adolescents. In response to this unique challenge, the City of Houston's Mayor's Office, including my Office of Resilience and Office of Education, partnered with the Houston Endowment and Harris County Judge's Office to develop a child care solution for essential workers during this emergency. They coordinated a diverse group of public, private, and nonprofit stakeholders to develop a strategic child care plan and created a streamlined process for essential workers to find child care and apply for financial support. Today, we are pleased to announce that families of essential workers can register for child care and for financial support online at findchildcarenow.org. And that's now with a capital N, findchildcarenow.org. All essential workers, including all of the City of Houston and Harris County employees with children ages 0 to 12, are eligible to participate on a first-come, first-served basis. Once a family selects a center and the enrollment is confirmed, care can begin immediately. We have partnered with Collaborative for Children, a long-standing, respected nonprofit with over 30 years of experience in helping families find child care and workforce solutions. Collaborative for Children will contact applicants within 2 business days to help find them a quality, licensed child care center that best serves their needs. And if a family wishes to apply for financial support, they will be contacted by a representative from Workforce Solutions within 4 business days to review options. Workforce Solutions has allocated $10 million in for child care for the 13-county region of Austin, Brazoria, Chambers, Colorado, Fort Bend, Galveston, Harris, Liberty, Matagorda, Montgomery, Walker, Waller, and Wharton counties, which can provide child care support for at least 3,500 children of essential workers. I want to thank the nonprofit and philanthropic leaders who have come together to support quality child care for our essential workers at this time. And quite frankly, I don't believe that there is a similar program any other place in the United States. I especially want to thank Tanyelle Edwards, Program Officer from the Houston Endowment, who has worked very closely with Chief Resilient Officer Marissa Aho and Director of Education Juliet Stepech to support this effort. A very special thanks to Workforce Solutions, Bain & Company, Collaborative for Children, United Way of Houston, the YMCA of Greater Houston, First 3 Years, Harvey Home Connect, Texas Public Lab at Rice University, the Bridgespan Group, and the Baker Institute at Rice University. These are challenging times, no doubt. But together, in Houston and Harris County fashion, we will get through this because we are, as we've said, hashtag Houston Strong. Juliet?
Thank you, Mayor. Before we proceed, I wanted to say that we have a wonderful ASL interpreter here. He's not wearing a mask because he needs to be able to demonstrate what we were translating at this point. So just a huge round of applause and thanks for your interpretation at this time. Also now I have the distinguished honor and privilege of being able to introduce the Harris County Judge, Lena Hidalgo.
Thank you so much. Juliet, before I begin, I'd like to share a sad milestone that we've crossed in Harris County, and that is right now in all of Harris County, including the city of Houston, we have just over 1,300 diagnosed COVID patients. So we crossed 1,000 a couple of days ago. Deaths have now very well entered the double digits. We are at 20 people who've had their lives stolen by COVID-19 so far. Across our region, beyond Harris County, over 2,000 people have tested positive. And I want to be real with people. I don't think that these numbers truly represent where we are. I believe, and those who are looking at the hospital data believe, that the numbers are much higher than this, that for every person who is diagnosed, as we've been saying, there's probably a few, maybe up to 5, who've not been diagnosed. It's been a challenge because we don't have the access to testing materials that they do in other countries. And so we can't possibly test enough people to have a fully accurate count of who exactly has the virus. And so it's time to remember just how important all of our work together is. To those of you staying home, I want to say thank you again. And those of you that are not, and really it's not too many, but they're still out there. I know Palm Sunday was this past Sunday, and anyone who went to spend time with people not part of their households, you put them at risk. If you go see somebody who you do not live with, you are putting that person at risk. And so we have got to continue to take personal responsibility for this, because the reality of it is the sooner this virus can be controlled, the sooner we can go back to our lives, the sooner the economy will recover. And if we don't put our foot forward, our effort forward, this will last longer. The economic downturn will sink deeper, and it will be harder for us, much worse. We will face the type of crisis that we're seeing now in New York, in other areas across the country and the world, and we can still avoid it. So we need everybody to do their part. If you absolutely have to be out, and that means essential workers. That means if you're out making a run to the grocery store, you're out making a run to the pharmacy, you've gone to the park to be away from other people still, and that's pretty much the only reasons why folks should be out and about. we are asking folks that they wear a face covering. The CDC issued new guidance that even folks who are asymptomatic may still end up spreading the virus through even talking, sneezing, coughing. They may have the virus and not know it. So if you are out in public, you should be wearing a face covering. Now, the other guidance that we received, and that's why I've brought this one, and I don't have it on because you can't hear me if I put it on. So that's why I'm speaking with it around my neck. But if you are able, please do not buy hospital or N95 masks. As we've seen in New York, we're already seeing doctors that have to use homemade masks, that have to use less than perfect solution because there is a run on the hospital masks. And so if you are able to access, I had this one made by somebody who gave it as a gift, and so I'm going to be wearing this one. And folks who would like to make one or understand how to wear one, how to wash one, etc., you can go to readyharris.org and the guidance is there. But we do ask everyone who's out and about to please wear some sort of a face mask, and ideally to not have it be the kind of mask that our hospital workers are going to need. So that's a N95 or a hospital surgical mask. Let me be clear, there is no substitute for social distancing. And so even though you're out and about wearing the mask, you still should stay away from other people, and hopefully the mask will help remind us why we are staying away, why this is not the time for a pickup game of basketball or anything that has to do with touching surfaces or being close to people that we don't share a household with. Today, I'm so pleased to join Mayor Turner and everybody here on the announcement of this resource. We've seen shortages of medical workers across the country, and we can't afford to have a single medical worker or grocery store clerk or essential employee benched because they have to be home taking care of their child because they don't have access to childcare. And so first responders, healthcare workers, grocery store clerks, other essential workers showing up for us every day, we have to show up for them. And what this effort means is that first, any essential worker who needs childcare will be able or should be able to find it, and any essential worker who has found childcare should be able to afford it. It is such a unique response from our region. So many folks coming together, Collaborative for Children putting together the portal, the Workforce Solutions, which is a state affiliate facilitating financial assistance, Houston Endowment providing funding, Bain and Bridgespan providing pro bono expertise, and of course the city and county. So folks can go to readyharris.org. That will link also out to the website the mayor shared in Childcare Now. And so anyone who is an essential worker can register for childcare. Folks, the link is and the information is also available in Spanish, and we're working to make it available in other languages as well. And folks will be paired with a childcare provider. These providers are screened to ensure that they're following CDC guidelines for how to be as safe as possible with taking care of our kids. And folks who need financial assistance will also apply directly, will get support and access the financial assistance that they qualify for. Essential workers are our safety net right now. They are literally keeping this community together, keeping our supply chain going, keeping everything going, and so we need to make sure that we are there supporting them. I want to announce another program that is in response to a question we get a lot. You know, we've discussed our healthcare workers, their children. We've talked about each of us, needing to use a mask. Oftentimes, we're asked, what about our homeless population? We tell people, if you're sick, assume you have the virus, stay home. Really, you should be home anyway, and unless you're an essential worker. But what if you don't have a home to stay in? What then? And so we can't take for granted that the fact that many folks who live in homelessness do not have a place to go to. Starting this past Saturday, in a partnership with the city of Houston and various organizations, we have set up a system for folks experiencing homelessness to be able to access emergency housing. And so we have enough capacity right now for 60 people. It can grow. We've got capacity to expand, and we're basically working with the homeless shelters and with hospitals. If they identify somebody who is COVID positive or has symptoms and is likely to be COVID positive, they will refer these folks, and who are experiencing homelessness, they'll refer these folks to the program, and we've got the system set up. The city right now is providing the facility. The county is providing the wraparound social services, and we're basically providing support for folks to be able to stay in isolation while still being fully supported. And so anyone who knows of this issue, they can call our nurse hotline on Ready Harris as well and be referred. But right now we're working very closely with the homeless shelters and with the hospitals in this response. Another quick note, you are going to begin seeing trucks at our NRG complex. We are moving forward at the county with establishing a medical shelter, and that's what we need to call it for the purposes of our relationship with the federal government on this. So the federal government is supporting, and they'll support through reimbursement, ideally, what we are building, and that is a medical shelter that is to be used as a last resort. We hope that we don't get to a point where we need to use it. That would mean that our hospitals have used up their capacity, have used up their surge capacity, and now we'll have to use the capacity we're building at NRG. We're, in the meantime, going to find what other uses we may have for it, and so we're working on that. But so far, the construction will start right now in the parking lot of NRG. We right now can't build it indoors because, of course, we're still cleaning out from the rodeo. And so that would be a dangerous situation for anybody with respiratory illnesses to be around all of the materials that are necessary for the rodeo. So it's being stood up outside, and I just want to give folks a heads up. That's what you'll see if you drive by or you're by NRG. That's coming up is this medical shelter that is something of a last resort. And the final note is just anybody who wants to support, just a reminder, you can go on readyharris.org to volunteer, to donate to the recovery fund that's been established. And there's another plug I want to put in today just for the Houston Food Bank. I know, Mayor, you toured their facilities this weekend. We've been in touch with the food bank, and they're telling us, they continue to need volunteers. You can access that through Ready Harris. But they also are in urgent need of financial donations, not so much donations of food, but donations of money, so that they can be efficient in the use of those resources, purchasing the food that they need. And so if you will go to houstonfoodbank.org, if you're able to make a financial contribution, they need everyone's support right now to provide for our community. So I'll leave it there. I'll repeat my remarks in Spanish, and then I also obviously will be available for questions in the end. One more number, actually, that I do want to mention, and is we talk about we crossed 1,000 people who have been tested positive. I also want to note we're about to hit double digit in terms of the jail staff who have tested positive for the virus. At least 3 inmates are positive. 3 dozen inmates are now experiencing symptoms, and we expect we're pretty confident that quite a few of those folks will come back positive. At least 800 inmates are being quarantined as best we can do that within a crowded jail. And so we don't need a doctor. We don't need to have a doctor here. We don't need to be a doctor to understand the jail has cramped conditions. This is going to spread like wildfire if we don't do something to substantially, quickly, of course carefully, but quickly reduce the population in the jail, because these folks getting sick are going to need the same hospital bed you and I may need. And so I'm very, very impatient, very, very concerned at the time that we're wasting right now on the jail. And I think history will remember people in 2 ways: those who took bold action to ensure that we are stopping the spread of the virus, and or those who dragged their feet or worse stood in the way. And so I sure hope that everybody is working in concert right now to get quick resolution going to the situation in the jail, because it's extremely concerning, the numbers we're getting just every day. I've gotten messages from family members of the jail workers saying they are so frightened to see their loved one go into work in these circumstances every day, and we've already identified nonviolent people who can safely be released after careful screening. En español, repito brevemente.
You're listening to Harris County Judge Lena Hidalgo, and before that, Houston Mayor Sylvester Turner talking about three big new developments during this morning's news conference. One being the county is moving forward with establishing a medical shelter to be used as a last resort. This is going to be at NRG Park. Construction is set to begin in the parking lot, so you may notice that as you're driving by. They're still cleaning out indoors because of the rodeo. So this emergency medical shelter to be used as a last resort, Tanaya, is being set up in the parking lot.
That's right. So they said don't be alarmed if you see all the trucks and the crews out there. That's what they're going to be doing. Another big announcement that was made by Mayor Sylvester Turner. He said they are, all the essential workers do have to go to work, and a lot of them are having a hard time finding childcare. So now they're offering a streamlined process for those essential workers to find childcare. And on the website, they can even apply for financial support for that childcare. Now, this is for all essential workers with kids anywhere from, 0 to 12 years old. First come, first served basis. It is findchildcarenow.org. And Judge Lena Hidalgo said they'll also have the link to that on Ready Harris. So again, all essential workers, if you do need help finding childcare, these people, they said they're screened, they're certified, they know how to, best protect your children from the coronavirus. So it's an option now, a good option for essential workers to find that childcare.
Yeah, and finding quality childcare resources has been extremely challenging for these essential employees during this pandemic. They can also get financial support as well as they try to find the right child care provider for their children. Something else that Harris County Judge Lena Hidalgo talked about is working with local homeless shelters and hospitals in our area to set up a system so that homeless folks can access emergency housing. She says right now, the way the system is set up, this is a new program. They can accommodate 60 people. They want to make sure that resources are available for the homeless in our community. She has said many times before that she's concerned that the virus will